I hope Barack Obama can. Now, we can do something ourselves. We can go back to the grassroots level, and we can devise programs at the city level, at the county level, and at the state level, eventually, where we are doing what we need to do to shift to a new paradigm. See, America needs two things. It doesn't just need health care for everybody. If it was just health care for everybody, we'd have the same system we have today for everybody. And that's what we're saying is not working very well. So we need another ingredient in this mix, and what that ingredient is a health care package that's styled on prevention and wellness. If we ate right and slept right and exercised right, and we kept our weights down and reduced our stress, and we had a meaningful purpose in our life, we wouldn't need health care like we need it today. We would find 80% or 90% of the illnesses that we're seeing in this pandemic of obesity and diabetes and hypertension and heart attacks and strokes and cancer would disappear for the most part. Big Pharma doesn't want that. The insurance industry doesn't want that. Congress is not supporting it. FDA is in bed with them just as much. We didn't talk about that, but they are too. So we have to do something ourselves. It's not going to be like they're just going to come to our rescue, Congress that is, and have health care reform that looks to the big package. Where can you find all the information that shows you what's gone wrong with health care because of Congress, FDA, Big Pharma, the insurance industry, medical education, the research industry? Where are you going to find that all in one place? No book has been written to this time until I wrote this book, A Return to Healing, which has this in one compact book that's documented with a lot of medical research that shows this. And this research came from our own peer-reviewed literature. So we need to look at that big picture as a country and then to begin to devise approaches that we can take that will change this. And we can. It's within our power. We're doing that right here in Walnut Creek. We've got something called the Walnut Creek Wellness City Challenge, where what we're doing is we're finding at the grassroots level a program that will change the way the city of Walnut Creek and all the cities in Contra Costa County are eating. So we've come up with a program where we get the high fructose corn syrup out of it, no trans fats, and adding enough fiber to the diet. And every city mayor in Contra Costa County has taken the Walnut Creek Wellness City Pledge and said that that's what they're going to promote in their cities. Now, we did that ourselves here in Walnut Creek. Why can't we do that for exercise? And why can't we develop some community programs that actually are for the development of community? And why can't we look at some of the social impact of what our educational system is doing to our kids? We can do that here at the local level. We don't need big government to do it. We don't need our representatives in Congress. We don't need even the president to do it. If we can set the example here at this level, we've got a very good chance of setting that example for neighboring counties and finally for the state of California and the rest of the United States of America. That's one program, and I think it's a good one. We need also to have some transformation in health care. We need to have a kind of transformation that gives us medical freedom. We don't have medical freedom because the U.S. Constitution does not provide us with medical freedom. That was the one thing that was purposely left off because our forefathers didn't feel that we had enough information, enough wisdom, enough experience in medicine that we could make decisions for ourselves. Now, how much pressure they had from the doctors at the time, I don't know, but I get suspicious of it as I think about it. We need to have the right to choose the health care we want. Should you be forced to only use the Western medical system because that's what's here and that's what insurance pays for? Should it be that every system of health care, whether it be acupuncture or Ayurveda or Native American medicine or body work of some kind or any discipline you want, should that not be your choice? Are we so stupid that we can't figure out what we want? Can we not understand what's involved with different approaches to health care? And do we deserve to have our whole selves taken care of? Shouldn't we be able to have our bodies, minds, emotions, and spirits included in health care? We don't have that. So we need to have a new constitutional amendment that will do a lot to bring back health care freedom. And our insurance companies should be required to provide those kinds of services. For a while in the state of Washington, that was the case. Anybody that was licensed, any profession, any medical care approach that was licensed by the state was required to be insured by insurance companies. We don't have that. It needs to be changed. Our research needs to be opened up to wellness and prevention. We definitely should have programs that allow us to do that research. A lot of the time, the mainstream people are complaining that we don't have enough research in complementary and alternative medicines and in indigenous healing systems that have been around for thousands of years. Why shouldn't we be able to do the research? Why is 1% of the budget of the National Institutes of Health centered towards this? Why isn't it centered towards equal kinds of research on complementary and alternative therapies? Why doesn't acupuncture and homeopathy and Chinese medicine and Ayurveda, why aren't they all included in this program? They absolutely deserve to have that. We, the people, want to have something that's different, and we're not getting it. We should also be thinking about what kind of a system do we want for healthcare in general. Do we want this invasive, dangerous healthcare system that we have, which is fantastic in its technology? We've got gene research, we've got stem cell therapy, we've got microsurgeries that are done automatically with robots now. I mean, what we have is a fantastic system in this country. I would never want to put that down or throw it out. That would be stupid. But I also wouldn't want to use it as my first choice. Why would you want to have it as your first choice when you don't really need that? Wouldn't it be better to start out with lifestyle approaches so that what you do is you focus on diet and exercise and stress reduction and sleep and weight control and meaningful purpose? Doesn't that do a lot? Wouldn't that cut back our healthcare costs by 80% right off the bat? You bet it would. And then if that doesn't work, let's move on to something different. Maybe another strategy that's non-invasive, like acupuncture or homeopathy or some kind of other indigenous healing system. That would make sense. If those don't work, we can get more aggressive. We can start using supplements and herbs and vitamin pills. That's not very aggressive, and they're safe. There aren't very many deaths caused by that. And yet, when you look at the deaths that are caused by medications in this country, it's in the range of 400,000. There's about one death every other year from a vitamin pill. And if that doesn't work, then I'm into medicine. Yes, let's use those great technologies. Let's do the things that we need that medicine is so fantastic about. And I'm certainly behind it. So what we have is a new way of thinking. We need to be taking responsibility for ourselves. We need to reclaim the democracy that our forefathers gave us that made us able to live the way that we want to, and we've given back because the system has become corrupt. We can no longer trust the people that represent us in Congress. We know that. We have to take a stand and start doing things ourselves. These town hall meetings are going to do a lot of positive things for us. And they're positive things that can cause major health care reform, not just in the medical profession, but in every segment of our society. Because what we really need, if we're going to progress to the next level of what this country needs, it's a social transformation and an advancement of the principles of humanity. We need to evolve as a human species. It's business, it's law, it's medicine, it's science, it's sport, it's politics. All of them have the same flaw, that are based on economic return rather than service. Until we stand up and become the change we want to see, we're not going to see that happen. We can take responsibility as a whole by being that change we want to see, and there is then no way that we can possibly be stopped. Big challenge today. They have